Hey there, Pet Nation, Dr. T here, and I have something to say. Please do not be a... I want to tell two stories that happened this week with me and how it involved finances and how we could have better discussions to increase best patient care for your pets. Number one, first appointment of the morning. Me and my tech Anthony go in. We're doing an examination. I discussed with the owner that my associate last year noticed a loose tooth and recommended a dental. And I asked her how she felt about doing that this time. And I'm quoting here, "I'm not into dentals," which left me and Anthony shocked, and I'm continuing my exam, and then I said, "Can I ask why?" And the answer was, because he's only a dog. Now, words matter. And the heart of the issue was finances, and it came out later in the discussion. But my request from you as pet parents is that these words set the entire tone for more so Anthony, because it just set him off the entire day. He was down. Because I've dealt with this so many times, I was able to handle it much better. But yes, I haven't heard those words in a long time, and they hit to the core, let me tell you. There are options, and when or if there are financial issues involved, and I need to point this out, it's best to be upfront and honest at the beginning about finances, and to ease your minds, nobody knows how to deal with finances in the medical world better than veterinarians. We do this almost each exam. So we're very well versed at it. We're training our team to be very well versed at it. And our goal is high quality patient care. And I'm going to be frank with you. I'm going to offer the best, work with you to get the best of what you can do for your pet. But my moral, ethical, and medical oath is to offer the best approach for your pets medically. Yes, a dental can be fairly expensive, and when you're dealing with extractions, you are dealing with a surgical procedure, you're dealing with pre-surgical blood work to make sure everything's okay, you're dealing with the dental surgery that requires a lot of effort on the surgeon's part, and follow-up. Being the best medical care, that would be the best approach. But there are alternatives, and where the discussion would lead would be to things like pulse antibiotic therapy. Fraction of the cost, not as great as doing a dental, but boy, will it keep the infection in that mouth at bay for a long time. And so the pets that I have, either through finances or medically cannot get anesthesia, we talk about pulse antibiotic therapy. Setting the tone about he's only a dog, she's only a dog, they're only a cat, that really sets off the tone. So please understand, words matter. Story number two, yesterday. Ironically, again, it was the same tech Anthony. Individual comes in with two pets that we haven't seen in a long time. And it was a scenario where clearly we went through estimate after estimate, but the tone was completely dismissive. And throughout the exam, I'm dealing with an owner basically not even making eye contact, just sitting on their phone like this. Their son was making eye contact and talking. It was great. We had a discussion that way. But when I would do things like, well, there's some dental disease there, and so we're at the grade that we do recommend a dental, the words were, no, we're not going to do that. What should have transpired was, listen, I have financial limitations. I want to do something for my pet. This is what I'm able to do for my pet. We get it. You know, I tell the team all the time, clients would not be in the building if they did not love their pet. So they are physically here because they love their pet. So just by that act alone, we are willing to work with you. But don't be a... There are ways of talking about what the tests are. And ironically, these pets have not had blood work and were declined blood work at the previous vet. So we settled on doing a heartworm tick-borne test. And part of the discussion was, listen, what veterinarians do is they get finances bundled in order to do a lot of good testing that's great for your pet at a fairly reasonable price. Now, when we start talking about taking tests a la carte, if things transpire that can lead to more issues, the actual final cost can be incredibly much higher. And so far, that's the case. So I'm dealing with dogs not on heartworm or tick and flea prevention. We do the test. I've got 1 blood work result back, and we're positive for 2 tick-borne illnesses. And this test is a screening test. And as I explained to the owner, I said, ideally, what you want to do is you want to do another confirmatory test to differentiate between exposure, which the screening test does, versus active infection, which is what the follow-up blood work will do. That is incredibly more costful, that alone, than doing the bundled blood work that we had recommended. So the moral of the story is, the moral of the story is, please be open and honest with finances. Those clients that I have that do have financial constraints, we immediately know what approach to take. Again, I'm always going to offer what's best interest of your pet, but I'm going to work with you to do what you can do in the best interest of your pet. But there is really no need to be dismissive. I understand it's embarrassing that way. We've all been in some sort of financial issues at some point in life. But words matter. Attitude matters. We understand why you're there. We're willing to work with you. We deal with finances on a daily basis. We can make this a great outcome for everyone. So I hope that helps. And remember, everyone, love your pet like they love you unconditionally. Have a great day. And don't be a